A healthier, happier life begins here. Welcome to Mercy Moments, a podcast by Mercy Health in association with True Chat.
I would like to begin today by introducing the program's guest speaker and leading expert on the subject of human trafficking, Sister Ann Victory. I'm Terry Ceyler. I'll be your host. I also have years of healthcare-related experience and currently manage the imaging department at Mercy Health Urbana Hospital. On a program today, Mercy Moments will feature prescribers, providers, and other experts within the healthcare community and discuss issues that affect the local and surrounding communities. We hope to deliver a program that is professional, yet fun and engaging. Today, our program will address the issue of human trafficking. Human trafficking can happen in any neighborhood, community, or society. It can also happen to people of any age, race, or gender. So, Sister Ann, what exactly is human trafficking?
Well, human trafficking is a very complex crime, first of all, and it involves recruitment, harboring, transportation, provision, or obtaining of a person for either commercial sex, which tends to get most of the headlines, or labor trafficking. And the methods used by traffickers are force, fraud, and coercion. So that's the definition used by the federal law, and we like it because it is so broad. It covers a lot of the bases that we need to be addressing.
So what you're saying is there's basically two different types of trafficking, sex trafficking and labor trafficking.
Those are the two major types, and there are subtypes under each of them, yes.
Is it true that both forms of trafficking have common denominators? In other words, are the systems of control the same?
They're pretty much the same. This is all about money and control over another person. So
Right.
The person is viewed as a commodity, as an object for earning money or keeping control.
So who do you feel is the most vulnerable to human trafficking?
I believe there are lots of groups that are vulnerable because that's what the traffickers prey on. They
Right.
look for those who are vulnerable. So obviously children can be vulnerable because they don't always know what they're getting into. Men and women who are struggling to support a family and they don't have the means to do that. Those who might be running away from home, especially children who run away from home, can be extremely vulnerable.
Right.
The homeless, of course, are vulnerable. Immigrants can be vulnerable. The disabled can be vulnerable. And members of the gay, lesbian, bisexual, transsexual community, highly vulnerable. They're already pretty much ostracized or kicked out of their homes. And so the traffickers look for these kinds of vulnerable people, and they're the ones that they go after. They're looking at any of these groups or people as opportunities for making money.
So who are the traffickers graphically or statistically?
The traffickers are people that you wouldn't quite imagine. If I would do this for a middle school, I'd probably get an example, a description of the guy in the purple suit with all the bling and the big hat and strutting around. And wouldn't that be easy for law enforcement? That's not what happens generally. Right. It's a businessman running temp agencies in 14 states and not paying his workers and keeping their documents from them. It can be a kid on campus who decides he can pay off all of his student loans if he has a stable full of girls on the side that he sells.
Right.
It can be medical professionals. There's a case in Wisconsin. Husband, wife, both physicians trafficked a Filipino woman in their home for 19 years. They're in federal prison, which is where they belong. It can be members of the clergy. It can be a teenage girl as the trafficker. It can be elderly people who decide to run their business on the backs of people that they are making live on the premises and do all the work and not paying them for their work.
So recently I read an article that said that around 50,000 people are brought into the U.S. illegally every year. And what surprised me the most was that they weren't only coming from Mexico, but they were coming from the Philippines as well. So is that indicative of what you're seeing out there in the community?
Actually, individuals can be brought from anywhere in the world. The two countries you mentioned are in that mix, of course,
Right.
And many, many U.S. citizens are also being trafficked. So it's not uncommon to have our own citizens be part of that mix.
So that enters into a larger question: is how big is the problem? Is it a problem just in America, or is it a problem internationally, or how big is this issue really?
It's what we can understand. It is a huge, enormous global issue. And there are no good numbers because it's often a hidden crime. It's hard to count it. And who knows who's counting what. So that makes a challenge. However, the International Labor Organization has done some estimates based on their research, and they indicate that they believe about 40 million people, a little over that, are being trafficked somewhere in the world right now. They also estimate that this is about a $150 billion a year global enterprise.
Wow.
A lot of money.
Right. So what areas of America are affected the most, do you think?
I would say it's in every zip code. That's according to one of our friends who's a survivor. So it's actually everywhere. The National Human Trafficking Hotline does keep statistics by state of where they're getting the most calls. And right now, Ohio is number 5 on that list, according to last week's data. And the states ahead of us are Florida, Texas, California, and New York. So then it's Ohio. I guess I wouldn't want to be state number 50.
Right.
Because it's happening there, and the people there are not necessarily aware that it's going on there.
So you talked about labor and prostitution being the two biggies, but also in a couple of articles that I've read, marriage and organ removal is also a big reason for trafficking. Have you heard that?
Yes, I've heard that. It tends to be on the international level. There's more attention paid to that on the international level, but I believe it's probably happening in the U.S. as well, and we just haven't tackled that or found it yet. So I think it's enormous.
So how big of a factor is mental illness in the trafficking, if any?
I believe that would be a group of people that are vulnerable, that would be easily induced into being trafficked. And it's also an outcome of being trafficked because of the trauma, the severe trauma that those who are trafficked experience. They often have PTSD, like a soldier returning from war. They suffer greatly because of what's been done to them.
So what's the process? Someone gets trafficked, and I mean, what's the end game here for the victim?
The end game can be quite a number of things depending on whether they can get help or do get help. If they don't get help, the end game is often death, early death. But if they are able to get some sort of help, there will be a long recovery process.
I mean, is there a recycling and discarding process in this? I mean, do they work these people for a certain period of time and then discard them and replace them, or?
That's very often the case in prostitution, in particular, in sex trafficking. They're treated like a commodity, and when they're determined to be too old or too sick, which may be about 7 years is on average, they'll be discarded. They'll be tossed aside and treated like an object rather than as a human.
So, Sister Ann, what are the methods that the traffickers use to get their victims into this?
The major methods have been identified as force, fraud, and coercion. Now, force can be pretty obvious. It will be beatings or rapes or some sort of confinement or constraint. Very often these days, it's getting the person addicted to drugs or keeping the person addicted to drugs so that they cannot leave. They have to stay because of their need for that drug. Fraud would be the false promises that get people interested or lured in. A promise of a great job, a wonderful new life in America, a U.S. education, or even right here, I can give you anything your mom can't give you, so come stay with me for a while. You want that new cell phone? I can get you that. Or anything else that you want or need. And for people who maybe feel a lack in their lives of attention or concern or things, that can be very appealing. And then coercion would be the psychological threats, the things that keep people from ever speaking out because they're too frightened. So it would be things like, I know where your grandma lives in Guatemala. If you're not going to cooperate with me, she's dead. I know where your little brothers go to school. I get them if you're not going to go along with this.
That's really where the mental and verbal abuse come in.
It's huge. And I think people often have an image of human trafficking with ropes or chains or bars or tape across the mouth. And that's not usually the case. It's usually the psychological chains and ropes that keep people so bound and so frightened that they could never say what's going on because they're so fearful of the trafficker or of what would happen to them if they did come forward or who would ever believe them. They're very, very frightened. And that's the biggest factor, I think, in getting people to even say what's happening to them.
So, Sister Ann, how would we actually know that human trafficking was going on?
Well, the first step is always awareness and knowing what to look for, what you might see, and then knowing who to call if you see these things. And they can be rather subtle things, but it may be a person that you see out on the street who's always with someone, and the person themselves looks very fearful. They won't look you in the eye. They're very frightened. They're nervous all the time. That other person always speaks for them. They never let them speak for themselves. You notice that you know the person, and they have a whole lot of new stuff, clothing, jewels, nails, those kinds of things, and you know they can't afford it or their family can't afford it. Who's purchasing that stuff?
Right.
They have to work strange hours, and they have to live where they work. They have hotel card keys on them, and they're not tourists, so what are they doing with those? They have more than one cell phone, and they always seem to be concerned about that phone, and they're always listening to someone else talking to them on that phone. They have a lot of tattoos. Now, this is a tough one because body art's pretty popular, so what are you looking at, and what are you seeing? And these are often ugly. They may be barcode or the words property of or somebody's name or the word daddy or a dollar sign. And especially if you see the same one on more than one person, there is a pimp out there branding property like you would brand cattle. And that can be very distressing to see. So those kinds of things make it a challenge, but the observation becomes important, especially if you see more than one in the constellation, not just one at a time. So our healthcare providers, our law enforcement folks especially need to know what to look for, and then how do they respond, and who do you call when you see these things.
This will wrap up part 1 of our episode on human trafficking. Part 2 will deal with the solutions or what we can do to help curb trafficking. But before I do that, I'd like to acknowledge TrueChat. All the podcasts on TrueChat pursue a common goal. TrueChat's mission is to educate people by providing honest, open, and respectful conversations. To access current or future episodes of the program, please go to mercymoments.org or use the Apple Podcast, Spotify, or Stitcher apps on your cell phones or other smart devices. So, Sister Ann, what can be done about human trafficking?
This is a major concern, and whenever I do presentations, I always like to include a portion of what you can do because it's pretty paralyzing. It's pretty overwhelming. So all of us can do something, even if it's only that we tell one other person what we learned about it. We've done something. But there are lots of efforts going on at the government level and at the local level to deal with this. The Department of State in the U.S. has been dealing with the issue since 2000. Law enforcement, FBI, all kinds of levels of law enforcement. The Attorney General is concerned with the issue at the U.S. level, but also at the state level. So all the states now are working on the issue as well.
So which agencies do you think are the most involved in this right now?
Well, the Department of State does do an assessment of all the countries in the world every year on how well they are doing with addressing prevention, awareness, protection of victims, and prosecution. And so they address that across the world and rate the countries. So that effort goes on, and it does raise issues, including in our own country, about what still needs to be done. FBI is concerned about this. They are very active in it. In our state, the governor's involved, the attorney general's involved. There are task forces around our state made up of law enforcement folks, including Department of Homeland Security and sheriff's departments and local police, who are beginning to understand who's the real victim here, how to interact with them, and then what to do if you think you've encountered them. Social service agencies are becoming more aware. Healthcare organizations are learning that we could be seeing victims and not know it. We better learn how to respond so that we don't cause more harm, because we're always about looking at not causing harm and doing more good. The long-term efforts of needing to educate people, and that's ongoing. But how do we educate children to stay safe?
Right.
How do we keep them safe? What's going on social media? And how are children in particular accessing the information, or how are they getting lured in? And it's often now on social media rather than some other manner.
That brings up a good point, actually.
Yeah.
So how much cooperation is there from an international to a national level?
There is a lot of work going on around the world now, and there are some groups specifically focused on the international aspect. So the UN's involved in this. There is a group of Catholic sisters working worldwide on the issue. And so there are networks around the world just beginning to address the needs of victims, but also how do we stop the demand for this?
Right.
Businesses are becoming concerned and need to be more concerned about the supply chain.
Right.
Is it slave labor in my supply chain? Do I want it to be there? Hotels are becoming concerned because human trafficking in a hotel facility is really not good for business. And so getting the staff educated to recognize the red flags and who to call if there are red flags.
So I would think the interaction between the healthcare community and the police department is also critical. How is that?
It's very critical, and very often healthcare staff, especially in an emergency department, know the local police because they're in and out all the time with cases. And that's a good thing. So nurturing those relationships is a fine thing to do. You need the support. And when you think you have a victim of human trafficking, to be able to call and say, this is what's going on, you're believed, and they're going to come and try to help. Or the police are going to know, I take this person to a hospital. They need care. That's what they need first.
Right.
And so in, say, the Cleveland area where I'm from, all of our hospitals are doing that. We work with the local law enforcement. They all know to bring a victim or a suspected victim to a hospital first so that they get the care they need. And the interaction from law enforcement will come later. It's not going to be like on any of those law enforcement shows or the patient gets interrogated.
So it sounds like we're making a lot of progress in that area. Are there any other areas where we're making a lot of progress?
Those are some of the areas. I think we have a whole lot more work to do. Some of the courts are involved now. There are specific courts for victims of human trafficking, sort of like a diversion court. And we have some across the state. So Columbus has one, Cleveland has one, Akron has one.
And that's a good point. So not to treat the victim as a perpetrator, but as a victim.
Right. And that's a switch in thinking when you think about how law enforcement was traditionally trained about who's the criminal. It's been in sex trafficking, it's been
the prostitute.
The prostitute.
Right.
And maybe that's not a choice that person ever made. They're being forced to do it. So changing the way we look at what's going on is very critical.
So at a ground level, what tips do you have for people to stay safe? Let's say you're a child and you get approached by somebody. What are your tips to stay safe?
One of the tips, especially if it's on social media, be very, very careful about what you share. Your address, your pictures, any of those things should never be shared with someone that you don't know.
Right.
And this is hard for kids because they want a lot of friends, and they think this person that they're talking to online is a friend, and that may not be the case. So not wanting to meet up with this person ever, not wanting to send inappropriate pictures ever, because those pictures, contrary to popular opinion, go away. They never go away.
Right. They stay forever.
They stay forever, and they can be shared all over, and that becomes an issue. I think it's very hard for parents right now and grandparents. They worry so much about their children who have access to virtually everything if they have a smartphone, and that can be a huge challenge. There are new apps every day that look innocent and aren't. I just learned yesterday that a calculator app is not a calculator. It's something else. So it can be very frightening for parents, but to begin to learn what those are and instruct the kids how to stay safe, how to keep their friends safe. If their friends are suddenly not wanting to associate with their usual group, if they're going off by themselves, if they're 14 and they have a 24-year-old boyfriend, what's that about? Is it really a safe relationship or not? And then how to say no, how to say, this is not what I'm doing. I will not do that. Those are important lessons. I think at the base is, how do we help our kids learn to respect one another as persons and not ever, ever think that it's right to sell another person for any purpose. So there's a whole lot.
And for the parents to take back control of the situation. So what's appropriate and what isn't appropriate. And because for a millennial, taking their phone away is just short of killing them.
Well, and taking it away may not be the right solution anyway, but responsible use of that is
responsible monitoring.
Monitoring becomes a huge challenge. And I don't envy parents because I think it's very, very difficult to do that. And yet that's what's going to keep our next generation safe, so that they know how to respond to this and take it on as their issue, because nobody should be sold for any purpose.
Right, exactly. So how important is working together to solve this problem?
Well, as you can tell, the issue is very complicated, and no organization can do it alone. We have to learn how we can do it together. So that means law enforcement and healthcare and social service agencies and businesses need to find a way to come together on a common issue, common mission, so to speak, to bring our best to the table around the issue and not just keep it for ourselves or try to do it alone. Nobody can.
Right.
So it's really, really important to learn how to do that in a way that capitalizes on the good things that everybody has to bring. So not everybody can offer housing, and housing is a huge, complicated need. Not everybody can do law enforcement that requires professional skills. Healthcare can't do it alone either. So how do we learn to work together? How do we bring our systems together to make a huge difference on the issue? That's the only way we can get anywhere with it.
So what you're saying is it's more of a marathon than a sprint. And it's going to take a multilateral approach really to solve this problem.
It certainly is. And I think we have to look at the long-term end of it, because the needs of victims are so complicated. They need everything from the very basics of food and clothing and housing to long-term education and employment. And who in the community can provide that? How do we weave that safety net?
Right.
And we can only do it together.
So that kind of segues into what kind of organizations specifically are out there that you work with, or other organizations that are out there that are helping combat this problem?
Well, in Ohio, we have coalitions across the state, and they're all working on the issue more or less together, bringing people together to help resolve the issue. I work for the Collaborative to End Human Trafficking. That's basically our coalition, so to speak, in Cleveland. And we are working with over 50 organizations to do just that. We do a lot of the education and awareness, and we connect services with all of these organizations and agencies so that we can bring our best to the table and resolve some of the ongoing issues that victims really need. What services do they need? And how do we stop the demand, which is an area we haven't gotten to yet? How do we quit needing, so to speak, to have sex for sale? how do we quit needing to have these big bargains where the harm is on the part of the person who had to make this product or to get the resources for this product so that I could have something cheap.
Well, it can't just be a movement where it captures the public attention for 6 months and then they move on to something else. It has to be a revolution to where every time this comes up, we combat it.
Yes, I think so.
To various degrees, right? Exactly.
I think so. So it's not only a church issue or a business issue or a school issue. It's everybody's issue.
So it's there's a reaction every time this happens.
Yes.
Right? Exactly. Mm-hmm. Before closing, I'd like to remind everyone that new episodes of Mercy Moments will be released the third Tuesday of every month. You can listen to True Chat podcasts on Spotify, Apple Podcasts, Stitcher, and anywhere fine podcasts are found. For Mercy Moments on True Chat in Urbana, I'm your host, Terry Ceyler.
And I'm Sister Ann Victory.
I'd like to thank you for tuning in, and we'll see you soon.